So before we get involved with the panelists, I'm really pleased to introduce Professor Stanley Zlotkin. So as most people know, Stan is the chief of the Global Child Health at the Hospital for Sick Children in Toronto. His research interests include nutrition, especially iron deficiency and evidence-based nutrition public policy. He has active research programs in Canada, Ghana, Mongolia, and India. I think most of you probably know he's developed a micronutrient sprinkles program for home fortification, for iron fortification, and which Stan and his team have pushed beyond just scientific innovation, but to ensure that the innovation reaches the children and families who could benefit it most. He's currently the co-PI with Daniel Roth on a Saving Lives at Birth seed grant. And I think he's going to talk to us about, what he sees as some of our major public health challenges, figuring out how to deliver, disseminate, implement, and scale effective innovations. And I think he's also going to talk a little bit about the role of the innovators themselves in this process. So it gives me great pleasure to introduce Stan. Thank you very much.
Thanks, Dan, and good morning, ladies and gentlemen. I think you'll agree that Peter and his group here have done a phenomenal job in the last 3 days. This has been an amazing meeting, quite amazing, and hopefully I can add a little bit to it. As I speak today on the topic of delivery, dissemination, implementation, and scaling, the challenge of 21st century public health, the title is really meaningful to me because I think actually, although I say this tongue-in-cheek, developing a new product, new vaccine, a new intervention is hard. But I actually think that this dissemination, implementation, and scaling is at least as hard. And I think we spend a lot of time talking about the products and the innovations and perhaps not enough time thinking about actually how we're going to deliver them. While I'm giving my talk over the next 20 minutes, I'd like you to think about your particular projects, innovations, products, and see how you fit into the theoretical framework that I'm going to present to you. It's really a simple framework, so you'll be able to follow it really easily. It's an unproven framework, but some ideas that I have around perhaps a way forward, or a way of thinking of how we can bring our innovations, our programs forward from the implementation to scaling. So this lecture is actually going to be in 20 minutes. It's going to have 5 chapters plus an introduction. The introduction is going to be really short. It may or may not have a happy ending. In fact, we're not going to know for a number of years whether the ending is happy or not. So the introduction. I've already said we need to be innovative for successful, or people have talked about innovation for a successful product development, program development. We haven't, as I've said, been talking enough about the innovation that's needed for successful scaling. Where we need to be innovative and novel is in how we both produce, deliver, distribute, and encourage the utilization of potentially life-saving and life-enhancing interventions. And here the issue is our innovation has to be not on the product side, but on the delivery side, just as important. Inventiveness in sustainable innovation is about using existing knowledge to create new solutions, and very importantly, from the perspective of the very poor, a socially innovative intervention, a good value proposition for the end user, is one that is impactful, and in fact, one that can be seen of value to the end user. And I think this is really important when we're talking about innovations for the poor. Both the innovator as well as those receiving the innovation have to have a shared value proposition for what you're putting in front of them. So, chapter 1 is called Knowledge Translation, Implementation, and Scaling. And one of the points that I want to make is that knowledge translation is not the same as implementation, which is not the same as scaling. Generally, in public health, and I think this is really an important point, I think that only proven intervention should be scaled. And at the Saving Lives at Birth group yesterday, we talked about this. I asked a question about this. I really do think it's inappropriate to be scaling interventions that are proven to be efficacious or of value. So I think the last point here, very importantly, is I think a given, and that is that only proven interventions should in fact be scaled. So here's the beginning of a schemata to show the difference between knowledge translation, implementation, and scaling. So the first point is that we have an innovation. It can be a product, it can be a project, and when we have this innovation, I think that at least from an academic scholarly point of view, we have to do research to prove in a setting that's probably optimal that the innovation works. And in fact, it's not enough to have one research project to say there is proof. And in fact, it's often necessary to have 2 research projects, 4 research projects, or even 10 research projects. And the process that often happens is that one does a meta-analysis or a systematic review of all the research on a particular topic, and only after that's done, or sometimes you need even 2 or 3 systematic reviews, can one say you have a proven intervention. So you have an innovation, you have the validation component, which is with the research, you put it all together to have a proven intervention, and you translate this knowledge in various ways. It can be through publication in journals, it can be coming to meetings like this, it can be using social networks. There are lots of ways to translate knowledge. This is where I see knowledge translation. The next step is the implementation step, and that is taking the proven interventions and applying them in a local project. And there can be some science around this. One can call it implementation science. But I see the term implementation is taking the proven intervention to a pilot project in perhaps one part of one country. The next steps are to begin to take to scale. You may need multiple local projects, but you definitely need a champion for this or a sponsor for this. Otherwise, it won't happen. You go from local projects to subnational projects, subnational coverage, and then when I talk about going to scale, I'm talking about national or even multinational coverage. So again, we have 3 components. We have the knowledge translation part, we have the implementation part, and we have the scaling part. And of course, after something has gone to scale, there's a need for monitoring and evaluation. And I'd like to suggest that this is the big picture, very simplistic picture, but the big picture for knowledge translation, implementation, and scaling. Chapter 2, implementation is not simple. And don't let anyone ever say that implementation is simple. And if you think implementation is not simple, scaling is even more complicated. And I'm going to give you some examples of that. So let me use an example, and I apologize for using my own personal example, but it is an example I know best. And that's the example of home fortification with micronutrient powders. MNP is micronutrient powders. The trade name is sprinkles. And here's the delivery concept, a simple delivery concept. These are single-serve sachets, packages, containing a pre-mixed powder of vitamins and minerals that are easily sprinkled on once daily onto any semi-liquid food without changing the color, the taste, or the texture of the food. Home fortification the strategy enables families to instantly fortify prepared foods in the home. So you have a package, you empty the package into a bowl, you mix it up, and the baby eats it. It's a simple concept. These are some of the issues that were considered in the development of home fortification for infants and young children. All infants eat complementary foods, therefore it's a great vehicle to fortify. Babies should be breastfed. Ultimately, they eat table foods, but no matter where you are in the world, they eat these mushy foods called complementary foods. Therefore, it's a great vehicle to fortify. The form of iron is important. It should be a soluble form of iron, so it's absorbed into the baby's body. The iron should not change the taste or color of the food into which it's added. No matter how much I might tell a caregiver that even if the rice turns brown, it's still good for your baby, it won't work. People have been feeding white rice to their babies for 1,000 years. If whatever we add to the rice changes the color, it actually will decrease the adherence to that intervention. So very importantly, it shouldn't change the taste color into the food in which it's added. And of course, one must consider safety, avoid too much, but provide just enough. Again, pretty simple concepts. Here's the delivery concept. Again, very simple. Easy to use, highly acceptable among families and children, a food-based rather than a medicinal approach, does not require literacy, does not conflict with breastfeeding practices, can be used to promote the timely introduction of complementary foods at 6 months of age, and proper weaning practices, lightweight, easy to store and transport, inexpensive, low-tech to manufacture. Again, the point I'm making is this concept, hopefully you'll agree, is really simple. You have a package. The mother doesn't have to be literate to use it. She opens it up. She sprinkles it in the food. The baby doesn't know that the food the baby's eating is being fortified. A simple concept. It is not, however, simple when we talk about the supply chain to get this simple concept into the hand of the consumers. This is the supply chain for the delivery of micronutrient powders. On the left hand, we have the upstream. On the right hand, we have the downstream. In terms of upstream, mainly the private sector involved. They may have an existing facility or an infrastructure to, in fact, package the powder into these small sachets, Or they may have to build a new facility. Projecting demand will determine the scope of the scale. They have to cope with the regulatory environment and product registration, which is different in every country where they're working. Sometimes the product is considered to be a food for registration properties, and sometimes it's a medicinal agent. One has minerals and vitamins. They have to be blended. You have to have the right package. And there's also internal and external QC and QA. And there has to be research and development on the upstream side. When it gets to the downstream side, two things can happen. The distribution can be via the private sector or by the public sector. And you can see if it's the private sector, one has marketing, retail outlets. If it's via the public sector, there are a number of choices. It can be through NGOs. It can be through governments and UN agencies. The point of the slide is to make the point that the simple concept, it is really a simple concept, but taking that concept and actually delivering it to the individual is anything but simple. Chapter 3, sustainable scaling, choices and complexities. In fact, this is probably the most important chapter, so pay attention here. So, I'd like to suggest that there are two potential opportunities for sustainable scaling. One is scaling by replication, and the second is scaling by custom design. And let me tell you what I mean by each of these. So scaling by replication. Scaling by replication involves a process by which local solutions, that is products or programs, are exported and implemented elsewhere with little concern about variations in local context. The kind of one-size-fits-all approach presumes a universal logic in implementation. What works in one place because it's a great idea should therefore work in another place because it's still a great idea. It assumes that good ideas from a supply side and functional point of view should obliterate the contextual variation that we find in places within countries and around the world. So the first method is scaling by replication. The second is scaling by custom design. And here, the local variables and local context are paramount. These become most important. Solutions are custom designed to fit specific local contexts. They're shaped by costs, by customs, by norms, and by existing practices. This approach is intuitively appealing, but it rarely generates the efficiencies and economies of scale critical in the broader scaling up process. So one is replication, and the other is by custom design. And we're suggesting a middle ground approach, one which helps to identify the sweet spot between replication and custom design. So here, to find the sweet spot, one must identify and adapt the efficiency core of the program or product. The challenge in scaling rests not on the ability of implementers to replicate entire system solutions, but rather to identify the efficiency core of the solution, which can be most efficiently adapted, modified, and tweaked to fit varied local contexts. So let me give you two examples. Here's an example that you're all going to be familiar with. Here's the efficiency core of McDonald's. Of course, McDonald's was started by Mr. and Mrs. McDonald in 1940. It was incorporated in the 50s, and today there are 33,000 McDonald's worldwide. This is the efficiency core of McDonald's. The system involves a typical teenager at the McDonald's counter asking you what you'd like to order. It's the same teenager wherever you are in the world. It is so familiar, you've got the golden arches, the big M, Ronald McDonald, happiness and fun. That is their efficiency core. It's the same reliable, predictable service, similar marketing, high quality and consistency, willingness to innovate while striving to maintain consistency, convenience and location, they are everywhere. This is the efficiency core for McDonald's. However, they also have a little bit of local adaptation. So you can see on the right-hand side, you can see the big M, the arch of McDonald's, but there's actually some Chinese writing under it, which would not be present if this McDonald's were in Canada. The president of McDonald's China says McDonald's will be doing a little bit more this year to diversify its menu to appeal more to local palates by adding spicier sauces in its burgers. But the core offerings remain unchanged. He goes on to say, we're never going to get away from the core because people come to the Golden Arches for familiarity. He said, our customers have told us to be McDonald's. So this is really a clear example of an efficiency core and a little bit of local adaptation. So, again, sustainable scaling, two ways, replication and custom design. Let me give you the second example, and that's the micronutrient powders or sprinkles. Here is the efficiency core. You've seen this already. easy to use, highly acceptable among families and children ages 6 to 24 months. It's a food-based rather than a medicinal approach, does not require literacy, does not conflict with breastfeeding practices, used at 6 months of age to encourage the timely introduction of complementary foods, can be used with other ages, lightweight, easy to store and transport, inexpensive and low-tech to manufacture. This is the efficiency core, meaning that wherever you are in the world, all of this is true. It can be in the rural areas, the urban areas, it can be in Canada or Mongolia. All of this is true about micronutrient powders. It is the efficiency core. Well, what about custom design? In terms of custom design, it's primarily around the distribution. So you can have private sector for profit. You can have free distribution using primary care outlets. Of course, it's not really free. You can have free distribution via semi-annual health days, subsidized private sector distribution, social marketing, distribution with emergency food aid, distribution with unfortified food aid, or a conditional cash transfer. So I'd like to suggest that the local adaptation is the way it gets distributed or marketed. The next is an example of the packaging. So all micronutrient powders are generically called MNPs, but you can see from the slide that Sprinkles is the trade name for one brand of MNPs, but each country has its own packaging, its own name, its own language, and this distinguishes the MNP to individual jurisdictions. Again, the efficiency core is the same, but there's local adaptation. And I'm not sure if I can show this, but can you help me show this very short clip from Mongolia where they market micronutrient powders? And I'd like you to think about whether this would be appropriate in anywhere but Mongolia. And the answer, I think, is this is their local adaptation. So you can see the package is actually in Mongolian script, and it actually has a bit of a Mongolian baby on the package. Interesting, the music they use in the background. So again, the product in the powder in that was absolutely identical and will be identical. That's the efficiency core, and this is the local adaptation. We propose a middle ground approach, one which helps us to identify the sweet spots by custom adaptation of the efficiency core. If you can identify the efficiency core, then the local adaptation can be used to locally get the product to be acceptable. There are further complexities around scaling, and this is chapter 4. This is the big picture. I've already talked to you about that. You start with an invention. You go to identify the efficiency core, the local context. You end up with scaling up, and this is the big picture. But in this Sprinkles supply chain, you can see on the far right-hand side is the individual consumer. We can't actually forget the consumer. I'd like to suggest at the level of the individual, there is a need for demand creation, especially for a product like micronutrient powders, because one doesn't inherently know that their child has micronutrient deficiencies or is even at risk of that. There are two types of demand by the consumer. One is called latent demand. Latent demand is absolutely necessary for any type of scale-up. Latent demand is the desire or preference which a consumer is unable to satisfy due to a lack of a product or program or information about the product's availability. Two examples. One is, I'm really hungry, but I live in the countryside and there's no McDonald's to satisfy my hunger. So the latent demand is, I know what it's going to taste like, but it's simply not there for me to eat it. Another example of latent demand is the large number of adults with a cataract and blindness due to cataracts. They have a latent demand, and that is the demand to see, but they actually don't know what to do about that. The other type of demand is active demand, and this is actually generated at the local level through marketing and education. And I would like to suggest that you need both latent demand and active demand for successful, sustainable scale-up. This involves consideration of both the end users and the provider's perception of a good value proposition. So, examples of success in the last chapter. I mentioned earlier, a moment ago, about the latent demand for adults who have cataracts. So, there is a series of hospitals in India called the Aravind Eye Hospitals. People blind due to cataract have a latent desire to not be blind, but they cannot satisfy this latent demand because either there is no cataract surgery available to them, or in fact they don't know about the program. So the Aravind Eye Hospital has a unique and sustainable replicable model to meet this latent demand. Here is their efficiency core. It's efficient service, safe surgery at the right cost. In fact, they have a phenomenal cost model. For people who can't afford it, they pay nothing. For people who can afford it, they charge them. And the profit that they make from the charging actually goes to subsidize those who can't pay anything. But it's an efficient service, safe, and at the right cost. Local adaptation. They actually pick up and deliver the individuals who need the surgery in the local villages. They do the eye testing in the village. As soon as they identify someone as a cataract, they put them on a bus, take them to the hospital, and bring them back to the village within a 3-day period. There is a latent demand because clearly no one wants to be blind, and there is active demand that is convenient, respectful service at the right price, marketed in local villages. It is an amazing, sustainable program that really does emphasize the efficiency core and local demand. And the other example is the efficiency core of Sprinkles. And I've talked to you about that, so I'm not going to read this to you again. But Sprinkles has been relatively successful because I think we've identified the efficiency core and we've been able to locally adapt it. So, for example, 47 countries last year, through UNICEF alone, had one home fortification intervention implemented or planned to start within 12 months. Home fortification strategies were included in national nutrition policies in 40% of these countries. In fact, the micronutrient powders have been brought to scale in at least Mongolia, Bangladesh, Bolivia, and the Dominican Republic, and they have national distribution. The expected reach for MMPs in 2001 is around 14 million children. So again, I think through the combination of an efficiency core that is the same everywhere in the world and local adaptation, this is an example of a relatively successful program. And finally, we know what to do to improve nutrition and child survival. This has been well described in the Lancet series on child survival. But do we know how to do it well? And the answer quite clearly is not well enough yet. And as Dr. Margaret Chan, Director General of WHO, has said, the power of our interventions and all the evidence behind them is not matched by the power of our delivery systems to make these interventions available broadly and reliably to large numbers of people. Thank you very much.